Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Jay Masters came to the Mayo Clinic first as a patient, and he was diagnosed with stage 4 throat cancer. Stage 4 meaning that the cancer had spread to other organs or other parts of his body. Stage 4 is also called advanced or metastatic cancer. Not really what you want to hear when you go see the doctor.
After finishing treatment, surgery, radiation, and chemotherapy, Jay decided that he wanted to work at the institution that had cared for him, the Mayo Clinic. And that's exactly what happened. And here to tell us his story is Mr. Jay Masters. Welcome to the program. It's nice to meet you.
Thank you very much. It's great to be here.
Jay, thanks for coming. So tell us, I think it was November 2017, right, when you first came to the Mayo Clinic as a patient, and why did you come?
Well, I had been to see an ear, nose, and throat specialist at another healthcare facility, and he did some examinations and said, I think there's probably a better than 50% chance that you have cancer. And I asked him what the procedure would be, and he said, well, we would perform surgery to remove the tumor that's in your throat, and then you would probably get radiation and chemotherapy. And I asked him at that time, I said, okay, who would do this surgery? And he said, well, I would. And I said, okay, how many of these do you do a year? And he paused and he said, well, probably 6 to 8, depending on the year. And I thought for a moment and I said, okay. I said, doctor, I don't want to be insulting, but if I have cancer in my throat, I would rather have someone remove it who does 80 or 90 a year than someone who does 6 or 8.
Very astute.
And thank you, yes. And he said, you haven't insulted me in the least. He said, I did my training at the Mayo Clinic, and I know exactly who I'm going to send you to. He said, for what you have, the gentleman that I'm going to refer you to is the absolute best surgeon in the world. And I said, sign me up.
Yeah. Now, where were you? Where were you living?
I live in Harmony, Minnesota, so about an hour south of Rochester.
Okay.
And so we then made the appointments, and I just a couple of days before Thanksgiving of that year came in to see Dr. Eric Moore.
What were your symptoms that had you go see the ENT in the first place?
Well, much earlier in the year, I had noticed a discomfort in my throat and a slight change in my voice, but that didn't come until later. I saw a different ENT at another facility, and he said, oh, it's just a polyp. Nothing to worry about. We can remove that if it becomes a nuisance to you. Well, it progressed for several months, but then what actually precipitated my coming in to see my doctor was I started having some swelling at the base of my throat on the left-hand side. I showed my wife. She said, this is not normal. I want you to get it taken care of, to go take a look, see what it is, and go from there. I said, fine.
So you were referred to Dr. Moore, and how did the process of your surgery and your treatment go?
I guess the one thing I would start with was that we came in a couple of days before Thanksgiving. My wife and my parents were here for Thanksgiving to visit, and so they came with. I only had one sibling, and he died from leukemia when he was 25. So when my parents heard that I might have cancer, they were concerned. So we came to the Mayo Clinic, and all I knew at that point was one physician thought there was probably a better than 50% chance that I had cancer. So I had not received a full diagnosis at that point. We came to see Dr. Moore. My wife and I went in, and after an examination by a physician's assistant, Dr. Moore came in. He introduced himself, and the first thing he said to me is, I want you to know that we cure stage 4 cancer here all the time. And I thought, oh, well, that's great. If they can cure stage 4, whatever I've got here should be a piece of cake for them, And then he looked me in the eye and very calmly said, what you have is stage 4 cancer. My heart immediately dropped. My wife grabbed my hand immediately, and I remember that distinctly. She grabbed my hand, and I kind of went numb for just a few seconds. I thought, why me? Is this can't be possible, et cetera, all the things that run through your mind.
Understandable.
And then Dr. Moore continued to speak, but for a brief time, I felt like I was in a Charlie Brown cartoon. I wasn't really hearing what he was saying. All I heard was wah, 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 wah. But I quickly rejoined the conversation, and he said, this is very treatable. I think we can get it all, and then we can look at what happens next. Radiation, perhaps chemo, and we'll go from there.
So surgery first?
Yes, in my case, surgery was first to remove the tumor. And after about 4 to 6 weeks, I don't remember the exact dates, I came back in and started a 6-week course of radiation, which was 5 days a week.
Fun times.
For 6 weeks, so 30 courses. And then at the same time, I was scheduled for chemotherapy. So my chemo was scheduled for Mondays. And I started my regimen.
How did that radiation go for you? I said fun times, meaning that's a lot of radiation, and it's not a fun time.
Right, and I was warned about that by my care team. They said, this is going to get progressively more difficult, and at first it won't be that big a deal. And they were right. I went in and I went through my first radiation treatment. I thought, oh, this is a piece of cake. I'm going to slide right through this, not remembering that they had said it's going to get progressively worse. Radiation was difficult the deeper I got into it. And what I didn't understand at the time was that radiation builds up in your body. And so my worst days were actually after the radiation had been completed. And so the week afterward was very difficult.
I just have a quick question to back up a minute. How did they make the diagnosis, and where had it spread?
It had spread to lymph nodes in my neck. So in addition to removing a tumor that was about the size of the end of my thumb, they also removed 30 lymph nodes from my throat on the left-hand side, and 5 of them were affected with cancer.
Wow. All right. So radiation, chemotherapy, and then along the way you had a little trouble with infection, didn't you?
That's putting it mildly. Yes. I jokingly said that I can't get 2 Powerball numbers to match up, but I hit the trifecta when it came to infections. After 4 weeks of chemo, it had to be discontinued because I was hospitalized. I had a viral, a bacterial, and a fungal infection that they discovered once I was in the hospital. I also was complaining of some leg cramps, and so they did some additional testing and determined that I had a blood clot that ran the entire length of my leg, and I had another one in my lung.
Oh,
thank goodness you have recovered.
Well, and I understand now from my script when it says you were told that you were a miracle. That must be the reason why, if you made it through all of that.
Yes. After I had come through the 15 days in the hospital, I also had to have a feeding tube while I was there, by the way, because my throat was very irritated by the radiation to my throat, and so I wasn't able to eat enough to sustain myself. And so they, after 15 days, I went home with a feeding tube as well. And after I kind of rebounded and it was clear I was going to be able to return to work and my life was going to be somewhat normal again, one of the nurses in the chemo department said, "You had a lot more obstacles to overcome than almost all of our patients." She said, between all of the infections, the blood clots, the feeding tube, she said, "You're a miracle."
And so you took that comment to heart and decided you wanted to work for Mayo Clinic?
Yes, that's
you had been out of work for 6 months.
Through the course of before my surgery, I was off work the day before the surgery, and then I was not able to return to work for 6 months. Yes.
And what job did you apply for?
I actually had applied for about 5 different positions because I knew I wanted to work here. I had applied for something in marketing and a few other positions. The one that I got the first call about was the one that I accepted, and that is called a Desk Operations Specialist, or a DOS, where I room patients. I check patients in when they come to the desk, and in my case, I learned how to set up treatments for patients when they come back.
And then what happened? You were asked to do something else.
Well, yes. It was quite ironic. I ended up coming back to the department where I spent most of my time as a patient. I was hired in radiation oncology. So I'm not sure. I was told there were actually 42 departments that were looking for people that were in the pool that I was placed. So out of 42 departments, I ended up back in radiation oncology. Like I say, I don't know if it was divine intervention or just the luck of the draw. I tend to think it was the former.
And what do you do now in addition to being a desk attendant? What we used to call a desk attendant, you call it a DOS now?
A DOS, a desk operations specialist is what I was told. Well, I had been there for a couple of months or so, and my boss, my supervisor, approached me and she said, Jay, I've seen you with our patients. Several of them have noticed the scar on your neck and have said, what did you have? And so after some conversations with several patients, our social worker was starting to come to me and say, Jay, I've got this particular patient. They're struggling with their diagnosis. Would you mind talking with them? So I met with probably 2 or 3 patients that she had set me up with, and the ones that I was rooming. And my supervisor said, Jay, I've seen you with the patients. I've heard what you've been doing with the patients. She said, I think you have more to offer them than the way we are currently utilizing you. Would you consider begin a pilot program where you would work in the Charlton lobby, which is where radiation oncology is, and work with these patients? And after thinking about it a microsecond, I said, yes, absolutely. I would love to do that.
And what's the patient response?
It was quite overwhelming. I anticipated it would be good. Having been a patient, having lived those same fears and being frightened and not knowing what was to come, I truly understood what they were saying. I mean, it's easy to say, oh, gee, I know what you're going through. But until you've walked a mile in their shoes, you really don't. And so many of them, after they heard parts of my story, they immediately were gravitating to me.
Sure.
What I anticipated would be a 5-minute interaction with a patient was much more than that. The average interaction was probably 20 minutes.
That's a lot of job satisfaction for you, I would imagine.
It was extremely satisfying and gratifying to know that I was helping them to navigate not just their cancer or radiation. In some cases, I was helping them navigate Mayo Clinic and all the buildings and where to go for their next appointments. Many of our patients come from all over the world. Mm-hmm. And so many were trying to navigate Rochester and the surrounding communities. And I had multiple types of questions that would come up. But the one thing that I noticed was I was catching things in the waiting room earlier. When a patient would come in, a lot of times I would see them every day. I'd say, how are you doing today? I'm doing okay, but, I had one lady that said, I had surgery on my breast to remove a tumor, and I'm not sure it's healing properly. I immediately contacted her nurse and said, XYZ patient is concerned that her wound is not healing properly. She is not scheduled to see you for 3 more days. Would you like to see her today? And she said, absolutely. So the nurses actually told me, you're catching things in the lobby 2 and 3 days earlier than we would see these patients, and we're helping these patients to address these issues much more quickly. They're healing faster, and they're healing better.
And had you not gone through what you went through, it would not have been able to come full circle like this.
Exactly.
Is this the best job you've ever had?
In many respects, it is. It is very rewarding.
Mr. J. Masters, there are not too many people who come to the Mayo Clinic as patients and actually end up working here. Not just working here, but working in the same department where they were treated. J. Masters not only now works at the Mayo Clinic, he's making a positive impact on patients every day, helping others through the challenges of cancer treatment because he's been there. Thanks for sharing your story, Jay.
It's my pleasure. Thank you for having me.